My name is Luimbazi Jamilu, working with Star Medical Center Mbarara. We are located in Nyamichobola along Chizungu Road, opposite Nyamichobola Police Post, just 50 meters off Kampala Masaka Highway. And we are also located at Buremba Road, Kasinjonji Town Council, a few kilometers from Bishop Stewart University, before you reach Bishop Stewart University. As we are starting our reproductive health series today, we are going to talk about the most common diseases that we have seen the youth and women coming to our health centers with. And today we are going to focus on urinary tract infections and sexually transmitted infections. Mainly from our first teaser video, we are going to see the differences between a UTI and an STI. So a UTI is called a urinary tract infection. That's from the name, and the definition is any infections that affects within the urinary tract. Urethra opening and the urethral opening, the urethra, the urinary bladder, the ureters, and the kidneys. So that is a urinary tract. So the urinary tract infection is any infection that occurs within the urinary tract. And then for the STI, it's any infection that's transmitted during the course of sexual intercourse. It might be localized within the private parts or within the reproductive tract, or it can be systemic. Among the examples of a UTI has mainly a urethritis, a cystitis, amongst others. And when we look at the causative organisms of the UTI, we have the very common one called E. coli, which affects most of the people that come to the clinic. But we have others including Klebsiella, we have Proteus, we have Enterococcus faecalis, and the other very common example of tract infection is Candida, and then it has its own causative organism called Candida albicans. When we march to the side of an STI, we have very common ones that people normally come in with as outpatients. These have gonorrhea, we have bacterial vaginosis, we have chancroid, we have chlamydia, and those normally affect within the reproductive tract. And we have other diseases that can go systemic despite being transmitted sexually, and these ones include we have syphilis, we have HIV, we have hepatitis C, we have herpes simplex virus, we have herpes zoster, amongst others. We can also have chancroid affecting the system only. We can have genital herpes. It's a virus that mainly affects our private parts. So that could be a brief example of either of the two. In our subsequent videos, we shall be tackling one at a time, even those that I've left out in this introduction video. Now, how can one differentiate and tell that today I might be having a UTI and then the other time this might be an STI, or how can one know that he has a combined infection? In a UTI, we normally have lower abdominal pain, which is both in the UTI and in the STI, just because the bladder is below the umbilicus, and even the uterus is also below the umbilicus. So we have lower abdominal pain in both cases. In case the infection has ascended upwards, we can also have lower back pain in both cases. However, in a UTI, we can have change in micturition habits or urination habits, which may include passing out cloudy urine. It may include burning sensation on urinating. It can include having cloudy urine, and then it can also have increased frequency of micturition. You urinate here and again every time you want to go for a short cock. And then in UTI, in an STI, these might be normal. Your menstruation habits might be normal in the STI. And then in the UTI, we might have a normal discharge in case we don't have candidiasis. Otherwise, the discharge might be normal. Whereas in the STI, we can have increased discharge. This discharge might be smelly. It might have a change in color. It might turn to gray. It might turn to yellow. It might turn to green. And yellow, it might turn to green, and others. And then this discharge might have an offensive smell. It might have a fishy smell. It might have any other abnormal odor in case of an infection within the UTI, within the reproductive tract, which we can call an STI. Besides that, the people who have an STI really have pain during their sexual intercourse. In the UTI, it is somehow minimal. These people also have blood. At times, they say blood discharge during the intercourse. That might show that we have what we call cervicitis, or our cervix is affected. How are these two transmitted? The STI is called a sexually transmitted infection because it is transmitted through having sex. And then the UTI, at a given extent, it can be transmitted during sex, people that do both anal and then the normal sex. But mainly the UTI is out of hygiene and then misuse of medical products that may end up changing our normal flora. So for the UTI, most of the time it is hygiene related, from the toilets we use, from the underwears we put on, amongst others. Whereas for the STI, it is mainly sexually transmitted, except in the few cases that we normally have. A UTI is always an STI, since a single individual can control the UTI. And then when you come to us, the difference in screening, when you come with a UTI, your physician will always want to test your urine, what we call urinalysis. We do a lot of tests on urine. We can do urine biochemistry, we can do urine microscopy, and then we can do urine culture and sensitivity, amongst others. The other tests we can do normally for men that have had it, we can also do a urethral swab for staining, for gram staining, for culture and sensitivity still, and then for microscopy to see what is in the urine. The swab that we have taken off your urethra. And then for the STI, we really have a very big number of tests that we normally do for people having STIs. And these tests are very, very important, most especially premarital tests. We are supposed to do these tests before you get married. These include we have what we call a high vaginal swab. This is very important. And then we, in men, still, due to the fact that the urethra is the common organ, it supplies both the reproductive tract and the urinary tract. Urinalysis in men is also important, and then a urethral swab is also very important in men. The other tests for all the systemic infections are serological tests, which are used to test for the other diseases, including HIV, hepatitis C, HPV, syphilis, amongst others. So that could be a brief introduction today on seeing the difference between a UTI and an STI. So in our subsequent video, in the next video, we shall start with the UTI and we'll go into the details of the UTIs. Thank you for watching. See you in the next video.